Colleague, Senator Lankford is next.
Thank you. In a moment of earth-shattering bipartisanship, I want to be able to second what Senator Whitehouse was saying, because we experienced the same thing in Oklahoma with a disproportionate payment system for surgeons, physicians, whatever it may be in Oklahoma, based on other states around us on this. And that might have made sense 40 years ago. It doesn't make sense today on it. So that'll be one of the things I look forward to that conversation, to be able to figure out on that one. Mr. Stewart, let me continue on with you. You're going to have questions. All of you will have questions that will come up from some of my friends that are here on the dais saying, are you going to follow the law when President Trump asks you to do something? So, Mr. Stewart, in particular, since you're the counsel on this, I want to ask you some questions based on what President Biden did when he ignored the law repetitively, and it had a direct effect on my state and on the people in my state. Let me give you some examples. Title X funding is out there, does AIDS testing in rural areas, breast cancer screenings in rural areas all over the country. President Biden's HHS team invented a new standard to say if each state does not promote, not provide, but does not promote abortion in their state, they won't get Title X funds. He followed up with it in my state and cut off funding for AIDS testing, for breast cancer screenings, for all kinds of screenings in my state of Oklahoma, because my state wouldn't bend to his will and promote abortion in the state. They literally wanted us to be able to put a 1-800 number on all the health materials that went out from our health department saying, here's the number you can call to go get an abortion. When we said no, they said no AIDS testing funding for you. There's nothing in the law that says that. They just created that out of thin air. That had a direct effect on the health care in my state. The conscience protection issue is very clear in law, that if a nurse or a physician says to their hospital, hey, I don't want to be a part of an abortion, I don't want to be a part of sex change operations, that violates my conscience, the federal government is to be able to step in and make sure that conscience protection is actually protected. The Biden administration literally told everyone through HHS at the very beginning, we're no longer going to protect people in conscience protections, and then actually create a rule they sent out to hospitals to say, if you're a physician and you don't perform sex change operations, we're going to come down on you, literally violating the law on its face. ORR tried to be able to find new ways to be able to shuttle people to abortion, saying we didn't pay for the abortion, we just drove them there, provided staffing, provided the details. I can go on and on and on with the Biden administration, the way they ignored the law. So my simple question to you is, are you going to work to make sure that this administration follows the law that the Biden administration ignored?
So, Senator, I appreciate that question a great deal. It will be a theme, I believe, in terms of will you follow the law. I have a career that proves I'll follow the law. I believe in the four corners of the law as passed by policymakers, and that the role that I will have is to interpret the law and give good advice to Secretary Kennedy and members at HHS when it comes to interpreting and applying the law. And I believe my job is not to look outside of that and create new law. I believe policymakers do a great job of that themselves.
Yeah. Well, the simple thing here is we're a nation of laws. We want everyone to be able to follow the laws. And we're grateful to be able to have that fixed when previous presidents ignored the law, to be able to say, hey, let's just get back to following the law on this. Mr. Trillo, I want to ask you a little bit. You're going to have a lot of the budget issues and have a lot of big decisions to be able to make on grant making and how that process is going to go. I have noticed that a lot of the decisions for grants, if you go back and look at the grants and the grant decision makers, they're made by the same people year after year after year. And I'm always shocked that when Harvard seems to get a grant every year for the same thing, and you look at the grant decision makers, it's made of all Harvard graduates. Shocking that would happen when there are lots of other universities and lots of other entities doing great healthcare research all over the country that don't get a shot to be able to do it. So my simple question, you don't need to answer it completely today, because I want to be able to poke on this and say, grant decision makers need to change. They need to have fresh eyes that'd be able to look at it. And if the same people are making decisions over and over and over again on that, it'd be helpful to be able to get some new voices. When you're doing scientific research, getting stuck in a rut doesn't help in that. So I just want to be able to raise that to you as an issue. Is that fair?
Fair, and thank you for raising the issue.
The other issue that I want to be able to raise to you is just the decision about some of the healthcare grants as they're done just in general. There's been a lot of frustration about how some of the dollars go out and how some of the awards are done. So NIH in 2022 did a $350,000 award to develop a smart toilet using AI. Not 100% sure what the AI toilet is supposed to do. There's the federal taxpayers paid for a study through HHS about wearing helmets if they prevent injuries in West Africa. Now, I would tell you for free, wearing a helmet in West Africa has the same health effects that it does wearing a helmet in the United States. It's probably a good idea, but we paid for that. There was a huge study that was done to study the effect of climate change in a specific area of North Africa and its health effects on things. I think most Americans want to say, what are we investing our dollars in? We want good NIH research. We want good research on cancer, so many different rare diseases that are out there that are dependent on us doing the basic research. My encouragement is when you're doing the grant studies and evaluating who gets it, let's make sure we're putting the priorities into the places that needs to be put. Fair?
Fair. Thank you for the question.
All right, thank you.